who should be involved in your care. Your primary care provider. I think I started this talk by saying that I believe that you as a patient is the quarterback of your care, not your doctor, not anybody else. But when we are talking about your healthcare group, your primary care provider, your specialist, your physical therapist, your home health aide, your primary care provider should always be that quarterback. Because let's say if you have uncontrolled diabetes and you're seeing endocrinologists every month, and your endocrinologist becomes almost like your family member because they call you and they want to know everything there's going on, but your blood pressure is elevated, they're not going to treat your hypertension. So your primary care provider needs to get all of the notes, need to understand what's happening, and primary care provider is the one who sees you as a whole picture, as a whole person. It's called patient-centered care, where a specialist only sees you as a diabetic or your heart or your liver, whatever specialty you are going to see the most. Care coordinator or patient advocate, as I said, doctors' offices that are enrolled in what's called patient-centered medical home programs, they get more money from their health insurances, have the care coordinators or patient advocates. I also always encourage people to call their insurance company. So let's say everybody have Medicare and many people have secondary insurance. Secondary insurances like AARP, United, Aetna, they most likely have case manager through the insurance company. So don't think because they're secondary they won't talk to you, they will. Also specialists obviously should be involved in your care, but I wanted to tell people, don't think of specialists also, like I told you, like, oh, this is just my endocrinologist, they treat my diabetes. When you see your specialist next time, you have to say, hey, my endocrinologist, my blood pressure was increased, and now I'm taking, yet another medication. They need to know all that because it changes your overall patient picture. So they need to be involved in your overall care. And of course, your caregiver. I can't stress enough, I said that before, but find one person, teach that person, bring that person with you. And what's also important, if that person cannot come to your next doctor's appointment, it's fine, but bring all that information back to the person and tell them everything that happened to you. So now they're up to date. So they're not having questions and they don't have to call your doctor. And while it's fresh in your head, make sure that the communication is always two-way. And I think I was able to showcase kind of the difficulties that our elderly patients have with multiple conditions, multiple medications. I hope that I was able to enlist a sympathy to our primary care providers who work I'm sorry, but I'm going to say crazy hours, and they do everything they can to keep every patient healthy. But seeing that picture, you as a patient need to recognize and realize that only you and truly you should be the quarterback of your care, and you should have all the tools necessary to help yourself and stop relying on your doctors and primary care providers for everything, because things will ultimately fall through the crack, things are going to be missed, and things are not going to be maybe as you want them to be. So you need to learn how to take care of your own care and be your own patient advocate.